to ask you types of, or what are the things associated with mental disorder. Can someone, in that, we're looking at circumstances that can warrant mental disorder. Can somebody also, can it be something like self-imposed? People deliberately do certain things. Or what can you say about
That's
them?
self-imposed, that
Yeah,
because their
them
own.
say,
Yeah,
yes,
it's
deliberate act.
yeah, that's possible. Yeah,
Can it be
let's,
possible?
yeah, that's possible. Don't forget that when you don't mean well for somebody, just like she has emphasized, you it's okay when you don't mean well for somebody, when you dislike somebody, when you are envious of somebody, when you are jealous of somebody, unnecessarily you get excited, anxiety.
Okay.
Okay, the hatred for that person, that's this self-imposed disorder.
Okay, that one is your,
Yes,
is your that just
you
there,
sit
okay.
down, as you wake up, you see the sight, you see that person, you are angry, you hear the voice of that person, you are angry, you know, you just don't want anything. They come to tell you that person is doing well, or there's a good news concerning that person. Maybe the person just
Yeah,
gave
feel
birth.
jealous.
You feel jealous, you feel, yes, and you are envious, you are keeping malice. All of these things, the person is living his or her life, and you are just there hating for nothing.
Okay.
So this one now, you have self-imposed
Okay.
anxiety, because there's something called anxiety disorder. For nothing, you are just anxious for nothing. Even the scriptures has told us that it's a command that we should not be yes, that we should not be worried over nothing. You are just worried over just being, because of envy and jealousy for nothing, and you are causing yourself health issues. Oh yes, it happens a lot, mostly in this era. Yes, mostly in the act of, but just because of mere jealousy and envy, you are causing, you don't know what you are doing to yourself. When they mention the person, so you don't even mention, even in church, even in religious ground. Yes, the person is coming like this, you are going the other way. You don't even want to see eye to eye. If the person greets you, you pretend as if you were doing something you didn't hear. Even if you use your nose to answer and pass. I'm talking about believers. It happens. Even non-believers. Oh yes, it's
So all
possible.
this anxiety can be a self.
Oh yes, imposed. Yes,
mental
disorder. Yes.
That one is not the devil now.
No, that's you doing yourself. That's you doing yourself.
Let's look at other types. Okay, if we have types of mental.
Yes, there's post-traumatic stress disorder.
Okay.
Okay, that is popularly called PTSD.
Okay.
All right, this is a trauma that has occurred in the past. Then, like over and over,
Okay,
you
keeps
feel,
coming,
yes, it keeps coming because you haven't done anything like you haven't probably shared with, like, rape. Again, I'll go back to citing an instance with rape. You haven't shared it, you haven't told anybody about it. Once you keep having nightmares about it, then once you get even to the level, probably you even get married and you haven't shared it, and you want to get intimate with your husband or your wife, the memory comes back, and you know you cannot be yourself. You cannot live a normal life. Yes. So this happens a lot. This is why we advise and counsel that once you have such issues, like she had earlier emphasized, talk to somebody. It's very important that you talk to somebody. Talk to, if you cannot, if it's too distant away, or too, you feel you don't have access to experts, which are psychiatrists or psychologists. These are professionally trained in this area, all right, from traumas and anything. Let's not forget that these mental conditions has to do with psychological. They are psychological, they are, mental and all that. So you talk to people that have been trained professionally, that can counsel you, talk you over them, to that you can, you have peace within yourself, that you can express yourself to them, and they will know how to counsel you, the right direction to counsel you and all that. Then if you cannot afford or get close to such experts, if you have a family member, if they are young people, they should trust their parents and talk to their parents. It is very important that you talk to somebody, because it's when you keep quiet about them and you don't talk, that's where it's really very deadly. It's deadlier when you don't talk. Okay, let me quickly let's tell our listeners that we are live on Facebook.
You can also join us live via Facebook.
Yes.
A pure heart family.
Yes, pure heart family. Pure heart is one word.
Okay.
Then family is another word. 2 words. Pure heart family. Yes, on Facebook you see us live. You're not just listening to us. You watch us live. So yeah, that's it. So it is very, very important that they talk. You say again that
Types. You made mention. Okay, I said what?
You say again that how can people get people to trust that they can talk to? Somebody that will not judge you or mock you for whatever it is that it was not even. Most of these things that happen to people that give them these disorders, and most of them are not, it's not their fault. They just be probably at the wrong place at the wrong time, or at the right place at the wrong time, or things just circumstances.
You're going to be stigmatized.
They get unfortunate misfortune just befalls them. These things happen, because they feel that most people feel that they will be stigmatized. Then again, there's bipolar. There's bipolar disorder where somebody will have 2 characters, 2 attitudes. Yes, at times not consciously, unconsciously. They are two-faced. There will be one person now, you talk very well with the person. The next thing, the person that is still due to probably a kind of trauma, whatever it is that may have happened, has taken over that person's mental.
What did you call it?
Bipolar.
Bipolar.
Yes.
Bipolar disorder.
Bipolar disorder.
Okay. Now, before you go on to mention other types, is it possible to have disorder and you have disorder?
Yes.
Yes.
Yes, because when you have disorder, you will be what's that word I'm looking for? You will separate yourself. You will be like absent-minded. You hide yourself away from socialization.
Okay.
You will get tired of associating with people, like going out. Anything outing will not interest you.
Okay.
You will just lose interest in anything socialization. You will not want it. You will be indecisive. Should I not? You keep procrastinating and procrastinating. Okay, this is what you have to do, but that zeal to move forward. Yes, you are just weak. You are just that push, like to succeed. You are just
not there.
Exactly.
But you don't, and you cannot explain why you're doing that.
Yes.
But you have an intention to do something, but you don't
but
understand why
the will. Yes.
Okay.
The self-will to make
push.
you go ahead, to push forward.
And
you lose it.
You can't explain why you're doing all this.
Yes. This would have been as a result of something you must have encountered, something terrible might have happened to you, a bad experience, torturing, anything, trauma must have happened that has put you made you seclude yourself, enter inside your shell, and not want to mingle in any way, with the outside world. Exactly. So yes, when you start having these symptoms,
you know that something is wrong somewhere.
Yes, you know that
it could be as a result of a disorder.
Yes, you on your own. Just if in case people don't know the symptoms, that's what we are mentioning now.
Okay.
So when you are beginning to have all of these symptoms, then you know that something is not right. Yes.
Okay, let's see if we have other types of disorder.
Yeah, anxiety disorder, which I have said. Yes, I've made mention of bipolar
disorder.
Yes, then personality. Yes, there's also personality disorder.
How does that one?
Personality, when people tend to want to be who they are not.
Okay.
Yes, fake
life.
Yes. Yeah, that's. I think that yes, it's fake life because that's like having a inferiority complex.
Okay, that you can also ask. It's also mental disorder.
Yes, it is.
So when people go to, sorry to use this one.
Go ahead.
So when people go to Facebook and post certain things, they are not.
Yes.
Or tell people who they are not.
Yes, claiming
what they are not.
Yes, to be what they are not.
It's a mental disorder.
It's a personality disorder. Yes.
No, it's okay. Not mental.
It is. It's mental. It's just the different types. I'm just giving you the different types. There are different names, but in all, they are all mental disorders.
Okay. Because sometimes somebody will post certain things on social media. You realize this is not the person who he is. So this is happening as a result of
mental disorder.
Mental disorder.
Oh yes. Oh yes.
So listener, sorry, with due respect, if you
Yes.
post what you are not on air, you are posting what you are not on Facebook, it's as a result of mental disorder.
Absolutely. You will think, you will trivialize it and think, oh, it's just a lie.
It's a lifestyle.
Don't forget that it's from there, it's from up there.
Well, this is interesting.
Yes,
because
it is.
These are things that happen all the time. People
Yes.
post certain things they are not, and when you come to reality, you realize they are not what they are.
They really are.
So I've come to realize that this as a result of this mental disorder when you post what you are not.
Even having this entitlement mentality, where you're having a sense of entitlement. You have somebody that is helping you. It could be your relative, it could be a friend, it could be an associate or your colleague. Just like we've been preaching these days that if you feel you have a little more than your neighbor or someone around you, you share the little, share a little from it to them. Stretch forth your hand of kindness to people. But by so doing, people will now, if you remember the last time we were here, somebody sent a message to me that I should please talk about this. When we were talking about people being kind, instead I should please talk about the case. I don't know if you remember about people that have this sense of belonging, that because you are being nice, you are being kind, they will not take it as if it's their right.
Okay.
It's a mental disorder.
It's a mental disorder.
Yes,
when you keep demanding for what
because
you don't deserve.
What you
out
didn't
of right, not out of privilege now.
Exactly. You are not thinking
right,
you are not thinking that you are privileged to have that person in your life to help or assist you. You are not feeling yes, I'm a bit, but it's my right. You will not be claiming that is your right. Like I always tell people, it is not your right that people get nice or are kind to you. Okay? People have their resources. They can decide not to share. After all, giving is a virtue. Yes, it's a commandment. But how many people know that? Some people they have it in excess, but they don't give. While there are those they don't have so much in excess, but yet what they have they share, they give. All right. So for you to now start taking it as a right that you have seek someone's help or assistance, and the person is not forthcoming, you begin to hate the person, you begin to talk badly of the person. Maybe just this once, maybe you've been asking once, twice, 3 times or multiple times, the person has been helping and assisting you, then suddenly you ask this once and the person says I don't have, and you are like if this person used to have before, that means he's lying or she's lying. He doesn't just want to help me, or she doesn't just, you don't know that. That's wrong.
It's a mental problem.
It is. No, it's not. Jokes apart. It is.
It's a mental issue.
It is. For them to start feeling so.
Okay, so you heard about Patience, aka Precious Clear Bat. Let me use.
Don't mother her name.